Dr. Jaffe, do we recommend a certain method or a testing to find out if someone has had COVID, whether it's the PCR testing or the rapid testing? Is there an opinion that we would like to share?
We have an opinion, and there are many opinions, but I will give you my synthesis and my suggestion. It is very clear now that natural immunity is the most protective immunity because your T class white blood cells, called T cells, T lymphocytes or T cells, carry that memory. They carry your immune memory to RNA invasion, to RNA viruses, including COVID. Antibody tests somewhat correlate with T cell responses, but it turns out they are not really predictive. They are really not sensitive. They really are not specific, and they tend to go away fairly quickly. So antibody tests, no. Now the PCR rapid tests are different. They are specifically to assess whether you currently have infection detectable in your saliva or in your throat or in your nose or in wherever the specimen is taken from. So that's different. And then you get to today's T cell tests, of which I think there is only one. It has been approved for a few months. The company reports that it is specific and sensitive. But when you go and look at how many people were measured and what comorbidities were assessed, the answer was these had to be asymptomatic healthy people. So the test looks promising, but on small numbers of people. It's been out for a few months. It is a high complexity test. Not every lab can do it, although there is a kit that you can buy online, have sent to you. You bring it to a lab, you get a specimen, you send it to a high complexity lab, and a result comes back to you. If I remember correctly, just the kit itself is over $100, and the cost of the phlebotomy and the processing of the specimen means that you will be spending probably $250 to $300 to find out if your T cells are making any signal, because they're not measuring T cells directly. The specimen does not have live T cells that are cultured in the laboratory. The specimen identifies a certain sequence, a certain smidgen, a certain sequence of RNA and of DNA that indicate that your T class lymphocytes remember and are protective of RNA viruses, especially COVID-19. The next question, for which there is no answer at the moment, is does it matter which variant of COVID is measured? The Delta variant, and now the Lambda variant, and by the way, the mu and nu, these are just Greek letters, by the way. So in science, we're not that creative. We use a lot of Greek and Latin, but there are many variants, and it is very unclear at the moment. There is no data that I have seen objectively published in regard to how accurate, sensitive, and specific these so-called T cell fragment tests. They are amplification tests. And the very fellow who got the Nobel Prize for this amplification procedure says, be very careful because they could over-amplify a signal that is not quite what you think it is, but similar enough that it comes out that way on the test. So the short answer is there are T cell tests just recently approved. They are available both by kits online and through quality clinics. And I think we will be learning over the next year or two how reliable these tests are. And right now, there's only a minuscule amount of data, just barely enough data that it's statistically qualified for a rapid approval through the FDA, Bureau of Devices and Radiobiologics. So it is approved. It has been out, I believe, for about 6 or 7 months. I've been a little surprised that I have not seen any data either from the company or more importantly, from any research center that has used this to see in the open community, as opposed to a rather refined group who are sampled. In the open community, is the sensitivity, specificity, and predictive value the same? So please stay tuned. We're learning day by day, week by week, month by month. And in the meantime, follow nature's alkaline way. Read our risk reduction booklet, downloadable for free. Take a look at what we recommend so that if you have comorbidities, you address them. And if you don't have comorbidities, you celebrate and continue to stay well hydrated with a diet of nutritious whole foods that you can digest, assimilate, and eliminate without immune burden while you think and do yourself to lifelong well-being. So we are measuring lymphocyte responses in our lab. We have been doing that since the early 1980s. You would think that we could do a COVID test easily. Well, we actually looked at it and it turned out to be rather complex. Complex enough that we didn't have the time and the resources to tease apart where it was helpful and where it wasn't. And we report helpful information. We don't just report results. In fact, we report helpful information and an action plan to improve the individual's well-being. So in regard to these T-cell tests, they are finally out there. They are definitely what you want for long-term protection, preferably natural, but of any kind. And on the other hand, we really don't know much about them yet.